So it's my pleasure to welcome back Alok, Dr. Alok Choudhary. Thank you for putting everything there. That saves me a lot of time of reading stuff. And please welcome. Go ahead.
Thank you. Thanks for the invitation. Pleasure to be here. Um, so I'm going to talk about something some of you know me, and probably this is out of it's different from what I used to do or for many years. And there is a little story behind how I got into working with clinicians and emergency physicians and transplant surgeons. A few years ago, there was a rest of the world, it's soccer, we call it football, but there was a Euro Cup finals, and just after COVID, around 21 time frame. And one of my friends invited me to a bar to watch the finals. And it happens that there were two surgeons, also from Northwestern, where I'm from, at the bar. And we started talking and say, okay, what do you do? I do computer science and data mining and all applications of AI. And they said, hey, we are surgeons and we are interested in collaborating. And that's how this started. So it is sort of very interesting from my perspective, particularly a lot of practical issues, how you apply AI in decisions making, discovery, when people's lives are at stake in the hospital and clinical environment. So that's basically, and for many years I also got into and continue to do companies and entrepreneurship. So applying again AI and developing tools for various applications. So the people who are here in black on the top one are the surgeons and emergency room physicians. So we're going to talk about that. You have small data, how AI can help with discoveries and decision making, and what are the challenges. So where do I point? Okay. So just a quick background. I saw others talking about a little bit of background of what they do. So over the years, we've been working in basically HPC, data mining, large-scale data problems, machine learning, AI, and particularly applications in three domains. A lot in materials design and discovery. There are probably 100 papers in that space now, with a lot of material scientists across the US. Social media, data mining and analytics, which is more in the business domain, and companies who are in this space, and of course healthcare informatics. So that's the area that we've been working on from research perspective. Our group has been working on at Northwestern. And last year, in collaboration with Jeffrey Fox and Tony Hay, we sort of wrote a edited book, a monograph on AI for science. So it's about partly AI, partly fundamentals, LLMs, etc. A lot of applications in various scientific domains. So let me, and one of the very interesting things that I find is that this is a problem domain, or this is an application domain that you can talk to anybody in the world. right? As a computer scientist, many times I found it challenging to a certain extent to explain what I do or what we do and how they apply to applications and the real world situations. But everybody goes, everybody, every human being goes to hospital for either regular checkups or they know somebody who's had challenges. So it's easier to explain the implications and so on. So on this, I present two basic questions. One is inpatient case. So I'm sure we've seen a lot of these pictures, particularly during COVID, that their patients are on ventilators, right, in ICUs, intensive care units, and these are the questions that physicians, ER physicians, or ICU physicians um, struggle with every day, and they have to make life and death decisions or therapies, etc., etc. Right? So uh, essentially, the question. So if you are familiar with how doctors work when people are in ICUs or inpatient, every morning they'll go for a round, checking every patient, checking their vitals and lab values, etc., etc. And they ask a lot of different questions depending on what challenge or what disease a patient might have. So one of the questions basically for people who are on ventilators, they ask, okay, should you every morning, let's say, should I remove the ventilator today, right, and or tomorrow, etc., right? And they also want to ask, so if you're on a ventilator, if a patient is on a ventilator, it can result in what is called ventilator associated pneumonia. So it's not that you're giving oxygen, forcing oxygen into patient, because that can also result in pneumonia, which can lead to death as well, right? So you're between rock and a hard place. So this is the question that they face every day. Outpatients, where people, the diseases that last for years and years, there are questions like this. Again, this is all in pulmonary space. There'll be similar questions in cancer or other types of diseases. So, does a patient have a particular disease? So, this is like an autoimmune disease. So, it's a diagnostic. Can you discover that disease? Or would be predictive questions. Will a patient develop ILD? So, a lot of patients who have systematic sclerosis can develop ILD, which can be fatal, right? So you want to know whether that patient will develop sometime in the future. Future could mean 1 year, 3 years, 5 years, and so on. And if you can predict how far in advance, you can do the right type of therapies and so on. Or you want to do mortality prediction, right? So these are very challenging questions. So I'm going to just go through these two examples and describe some of the challenges and the work that we've done with them, uh, uh, with the collaborators. Okay. So the problem is very simple to describe, right? A patient is intubated, first day, second day, third day, and then you're asking the question, and then you make a decision. Yeah, keep intubated, and then sometimes, okay, extubate, right? So every day you are trying to use experience, and in this case, our goal is to figure out, can AI help, predictive modeling help, right? So currently, there'll be ventilator parameters, there'll be lab values with a lot of different types of lab values, other type of information, and based on experience, based on certain values of this, they make a decision. So it's more with experience and gut, and so to that type of decision is made. So can we model this data to build predictive models that can help them make a decision. Uh, and furthermore, these models be incorporated in EHR systems, right? You know, those complex workflow systems that hospitals have. If you've seen a doctor, you know, they're looking at their computer and trying to figure out various things. So this problem formulation and the questions. Um, let's see. Where do I go? So one of the challenges, at least this is in the US, and of course, I'm not too familiar with other places, is in the medical space, getting data is very challenging for all sorts of regulations and so on. And the amount of data may be very small. So one particular hospital may have hundreds of patients over the years, or maybe a few thousand and so on. So that's small amount of data. You can't go to 20 different hospitals, say, hey, let's get the data together. Too many regulations, privacy, and things like that. So the data sets are small. And when data sets are small, AI is challenging. I mean, I'm not talking about LLMs and other types of things in this particular talk, right? So now this is based on just 700 odd patients, but 940 ICU stays, 16,000 days, you know, so if you count the days, and you build models based on this with all the EHR data, all the lab values, etc., and you build these models, and if you're familiar with AUC curves, you essentially try to apply different techniques. It's also time series data because you're observing over a period of time. So you look at the accuracy and so on. Now there's another challenge here, right? It's very hard to know the ground truth, whether it was really a truth, because you are modeling you're building your models based on what the doctor did, right? Not on what should have been done, right? So that's a challenge. And of course, another interesting part is can you figure out what are the variables that are important for these predictions? Okay, so here are some simple results. I think this is published in some medical journal. So two things, right? One is, so you're making a decision every day, right? Decision whether you extubate next day, 2 days, 3 days, and so on. So this essentially shows various extubations on 1 day, 2 days, so on and so forth, right? So few observations, right? Um, um, that you were able to say, okay, extubation was done, and model also predicted the extubation. Now, many situations where extubation could have been performed early, right? So way in advance, that were not done, right? So if you look at one example, this is the way historical data showed. The model said, okay, you could have extubated here itself, right? So these are what a missed opportunity, right? So because if you keep patients intubated, of course, you can develop VAP, damage the lung, and so on. So and of course, it's very costly to be in ICU and be there. So both health issues, damage, potential damage, and cost savings as well. So what we found was that 65% of failed extubations are the ones you extubate a patient, and then within 48 hours you have to intubate the patient, right? Because it didn't work. Patient had challenge. Could have been prevented using these models. So these were very interesting results for these physicians who, of course, also work in the clinics and so on. So one of the challenges that is faced is how can you deploy where model is running while the physician is looking at the monitor and computers, etc., where these types of predict. Okay, extubate to tomorrow, or keep intubated, etc., etc. This is the question I would like to ask you. If a physician came to you and said, "Hey, I have an AI model, and model says I should extubate you, but my gut feeling says I should keep you on the ventilator," which one would you pick? For yourself or for a loved one?
The doctors.
The doctor. Anybody will pick AI model if they are, if they differ in the decision.
I love you.
Okay, so I have never found anybody who says if they differ that I'll pick the AI model, although the models show that there's significant improvement if you look at the historical data and the application, that they are much better in this situation. So this is the biggest challenge, or one of the biggest challenges that these guys face, right? So data is small, practical challenges, lives at stake, etc., right? And you can apply to many diseases here. Okay. So I'm going to one of the in order to help in order to address one of those challenges is large data sets are hard to get because you're hospital by hospital. You have to share, again, privacy and other types of. So people are starting to create these databases which are anonymized, where you can increase the amount of data and then start to work on these types of things. That's assuming if NIH still exists in the US. Okay. So if you I talked about the problem intubation, extubation. The complementary problem is, somebody is intubated, can you predict if patient may develop pneumonia, right? So it's a complementary problem. You're between rock and a hard place. So I'm not going to go talk about this, but in the same modeling, you can be predicting, okay, should I extubate, intubate for damage and other things, or for even for developing VAP. So, okay, so let's go to the next problem, if I can. If this moves, okay. Now, this is a problem which is an outpatient problem. Again, I'm giving just two examples, and you will find. So when it took me a couple of years, and I still don't understand, their language and the challenges, and when they talk amongst themselves, it's very, very hard. When the doctors, it's like a different world, right? And they are always, we as computer scientists, we are not looking at people's lives and so on, but they are. So they are all, their framework is always that. So here is one problem. Patients who have SSC can develop lung disease, which can be mortal, right? So it's an SSC is an autoimmune disease which is basically the disease itself attacks the cells of the body, and it's highly prevalent and is leading cause of mortality. Okay. The challenges again is current diagnostic detect disease after significant lung damage has already happened. So you look at this particular line here, right? So this is time here. Time can be 5, 10 years, 15 years, So you see this going up. So this is inflammation of lung, right? So when you're doing diagnostic, you can only see the inflammation here, right? You don't know whether it's going to go up. So the detection using current is done when a lot of damage may have already been done, right? So this is where you detect. Now, what this is again, for one patient, this is the data. The three types of data. One is EHR, which is, vitals and lab values and, medicine, all sorts of information there. Second is, of course, you may have CT scans and other types of imaging data, which is, uh, uh, not very frequent because very expensive. And if you don't have a reason, if you don't see an issue, why would you go around taking images and so on? And these are, uh, again, values. It's called pulmonary function test. If you've seen people, if you want to see your oxygen saturation, there is a little thing you put your finger in and it tells you what. So that's an example of the test. So there is data which is very non-uniform over a period of time, and so on. So very, very challenging data. So the problem formulation for machine learning AI is essentially, this is where detection happens today. Now, after that, either a patient will survive, right, here, or bad things will happen, right? So the challenge is essentially, can we use models so that before even this thing happens, can we start to diagnose and way in advance, right? That is the problem, right? So looking at all the data that may exist, and when I'm talking about time, we are not talking about 1 month, 2 months, 3 months. We are talking about, could be 3 years, 5 years, etc., because this goes on for years. That's the basic problem. Now, the challenge in that, so here is an example of, so this is for one patient, data over 22 years. So this is a patient which is good, who's not developed an ILD. So these are some lab values. This is functional value uh, test of measurement. So what this shows is that this patient never developed. There are certain values associated with. This is another patient, again, over a bunch of years. So we are not talking about data from 2 years, 3 years. We are talking about decades. So here the challenge is, okay, there was no ILD, then there was gap, right? So patient may not have been seen, etc., and then patient developed ILD, and then you have certain type of trajectory, right? So there will be a lot of missing data, no observations, etc. So now the goal is to figure out way in advance if disease will develop. So the goal is, can we improve diagnosis of patients where we've already established ILD, right? Because it's done manually, looking at radiology data, etc., etc. So and predict the risk of developing this and identify patients where you can, what type of therapies will work for them and so on, right? So that's the challenge. So what this shows, again, the data challenge here is, these are like few patients, right? So and these are the different, so these are outpatients. They're coming every 6 months, 9 months, a year to the doctor, and they do different tests, etc. So there are different types of that. So if you look at CT scan, only few of them have that. So very what should I say, sparse data, non-uniform, with different patients, different, lot of missing data, etc. So big challenge there. So second thing is very challenging again. If you looked at images, is there a dog or a cat or a car, etc. We see all that in public domain data. But here the things are different, right? If you take one radiologist and show them CT scan data to identify if there is an ILD, looking at the lung CT scan, two of them may disagree, right? So it's very hard to find ground truth. Now, in order to develop data sets, to even build models, you have to have confidence in the data, right? So actually, one of my PhD student developed this model, and then they took, so three radiologists divided patients amongst them. So this is A and B, A and C, and then they looked at data, and then we figured out if they agree, disagree, and they don't know each other, So in order to just develop the data sets for this type of problem. Okay, come on.
Yeah.
Okay, so the problem formulation using EHR data, which doesn't have images, and I'll show you the reason, because CT scans and others are expensive, and if there is no reason to do CT scan, doctors won't prescribe it. So you will not have historical data of no ILD, etc. Right? So that's another challenge. So can we use only the lab values, EHR type of data to predict? So so the hypothesis here is that clinical biomarkers are available for early detection, right? Second is we know that radiologists detect too late. They know only when they observe, right? So, but if you had this data, there may be some patterns that AI can learn uh, before it is visible to radiologists and so on. So if you had serial CT scans, then you can potentially identify these patterns. And the questions are basically, does the patient have ILD, or will the patient develop ILD? And and the labels are based on that data that I described earlier, right? So, here are some of the challenges, right? So you take a CT scan, right, and ILD was detected. First CT scan. That means you don't have historical data where you could have had no cases where there was no ILD, because if you detect it in the very first one, so that's a data challenge, right? Uh, and these are where no ILD is detected as you take CT scan, but amount of data that is where you have a negative CT scan over time and positive is very small. So that's another small data challenge. How do you build models? So what this shows is from 97 to 2000 something here, over the years, if this is the line where years from diagnosis, as you can see, historical, there is very little data, right? Where CT scans in. So now, and in their practice, they are starting to do more and more CT scans, so then develop, they can. So based on this, one can make a case for taking more and more imaging data as you go forward. And similarly, the pulmonary functional tests, hardly any existed before, and now more and more are being done. So these are evolving patterns, changes in practice based on this. So again, this is one of the models. It's very important if you take this to an MD and say, hey, use this model, they would want to know and compare with experience whether they are the right type of lab values, observation, etc., that are impacting this prediction, right? So explanation is very, very important. And so, and that was pretty good. They agreed, yeah, these are predictors for that ILD and so on. So these are some of the, so this is mortality prediction. Will patient live for a year, 3 years, 5 years? So again, pretty decent results. I think it's under review in one of the medical journals. As the time progresses, so 1 year, 3 years, if you want to predict way in advance, you're not going to have as accurate results. So performance with longer time horizon is reduced, if you can see here. So 1 year is better, 3 years, 5 years, and so on. And all of these have explanations of what variables are impacting. So of course, older you are, higher likely of death. And to interpret this variables, high values or low or no, this side is no death likely, and this side death unlikely. So these are all the practical challenges that we face. Okay, quick. So one of the things that we are working on now is, so these are CT scans. Scans are three-dimensional images, right? They're slices. So first you have to create techniques to just identify the lung, so you do segmentation, left lung, right lung, and then automatically figure out, the values in that, and then you want to provide those to radiologists to confirm. So this is something where you want to do multimodal, you want to use multimodal data along with other types of data to do diagnostic and prediction and so on. Okay, so with that, I'll stop and thank you for listening.
Thank you very much.